In this video we're going to show you how to apply all the 4 techniques on your calf muscle. The first technique is contract and relax. With the ball on your calf muscle, you're going to find a sensitive spot. If you found that spot, the goal is to keep applying pressure on your muscle and then contract the muscle for a couple seconds and release. Contract the muscle again and get a little bit deeper while you're relaxing. It's getting a little bit more sensitive now. Contract for 5-6 seconds and release. You want to make sure you keep having pressure on the muscle. We're going to repeat this 3 more times, where you contract and release deep into the muscle. Every time you're applying a little bit more pressure. Contract and release. Try to stay on the same spot. One more time. Contract and release. That's the first technique. The second technique is muscle release. In muscle release, you're going to put the ball right before your sensitive spot. When you found your sensitive spot, you're going to shorten your muscle by pointing forward. If you found the spot and you're pointing forward, your goal is to get your toes as high as possible. So you're going to contract them upwards. That way the muscle will be pulled underneath the ball. So you place the sensitive spot right before the ball, going to point forward, keep applying pressure, and then move the toes upwards. Make sure when you're pointing forward and you're pulling the toe towards you, you keep them straight. So you don't want to go all the way outside. The second technique, muscle release, point forward, apply pressure just before the pressure point, and lengthen the muscle underneath the ball. One more time, point forward, keep pressure, and pull your muscle upwards. That's it. The third technique is called constant pressure. In this case, you're going to keep moving around with your muscle on the ball. And all the time, you're going to keep applying pressure on the muscle. So I found my sensitive spot, and I'm going to keep rolling while I'm pushing on the ball. You'll notice that there could be an area which is sensitive. It doesn't have to be one spot in particular. You want to keep applying pressure, and while you're rolling, you're putting pressure on the muscle. Try some different angles on the muscle. You want to cover the whole area of your muscle. In this case, the calf is the whole back of your lower leg. And you want to keep applying pressure and look for those sensitive spots. All the way up to your knee joint, where the calf muscle attaches. And there's some sensitive spots. If you found a sensitive spot, remember you can stay there for around 30 seconds. Keep applying pressure until the spot releases and the muscle tension gets back or goes away. The fourth technique is massage with the hand. You're going to grab the ball in your hand and you're going to apply pressure on the muscle itself. Make sure you straighten your arm in this case. You're able to find specific areas in the muscle and try to find those sensitive spots. You want to walk all the way up, downwards in the muscle, and you're going to look for those sensitive spots. For me, it's in the middle of the muscle, a little bit downwards, and you can do two things. You can keep applying pressure, or you apply pressure and you move the ball a little bit, just past that sensitive spot. Make sure you don't press too hard, and when you're starting out, take it easy. It might hurt a little. To reach the outside part of this muscle, you're going to put the ball on the outside and lay your leg on the ground. You're going to apply pressure on your leg with your hands and your body. You want to find those sensitive spots, stay there for a couple seconds and apply pressure. Find your sensitive spot and apply pressure. Stay around the spot for a second or 30 until the point releases, and then move on to the next area. Okay, we've gone over the 4 techniques for the calf muscle. Make sure you take your time and practice those techniques. Try different techniques and see which suits you. Every person has their own preference in which techniques work for them.